Hi, I'm Tom Ockler and welcome to our October Clinical Pearl. I got an email from somebody a couple of weeks ago who said, Tom, you're always doing clinical pearls that relate to the little bit more active younger population. Since her clinical setting tended to be more geriatric, she said, well, why don't you do some clinical pearls that have a manual therapy slant to them that we can use in our geriatric settings? Okay, I can do that. So today I thought I'd talk about something that I have termed a Flexion Syndrome, which has to do with adaptation to a couple of issues. So I call it a Flexion Adaptation Syndrome. And if you've noticed, if you're working with a geriatric population, people tend to bend forward as they get older. And that creates some issues. For one thing, I think it's being caused primarily because the worst thing in the world for an older person to do is to fall backwards. They hate that idea. They have no way to protect themselves. So they figure they know they're going to fall eventually, so maybe if I just get the ball started by tending to do this and lean forward, that maybe if I have to go, I'm going to give myself a fighting chance with my hands to protect myself. Well, that creates a number of interesting scenarios. For one, if the person decides to get this started by leaning at the trunk, they're going to have to bend their knees and their hips so that they don't really fall over. For instance, if I just bend my knees, I fall backwards. If I bend my hips without bending my knees, I fall forward. So what they do is if they're going to bend at the hips or the trunk, they will have to bend their knees in order to maintain upright posture. Eventually, they start using canes and walkers and this thing stays put. The problem is that when you get tight hip flexors, you also tend to get weak and short and tight in the front and weaker in the back. So even standing up straight becomes a chore to them because they lose their gluteal mass and they lose their erector spinae and they're permanently stuck in this position. And it was all created by a fear of falling backwards. So I call this a Flexion Adaptation Syndrome. And what we're going to do is let you observe your patients for a month because they will probably have some issues with pain. One of the things I do to get them started helping out here is to retrain their core muscles and retrain their erector spinae and their glutes. And one of the simple ways you can do that is to have them up against a wall, just like this. And then you say to them, okay, I can feel the wall, have them stand about an inch away from the wall, and they're going to instantly bend forward. Encourage them to stand up straight and get used to the idea of standing straight with their belly in, their shoulders back, and if they can arch back a little bit, and if they say, I feel like I'm falling, no big deal. The wall is right there. And get them comfortable 30 seconds, a minute, 2 minutes, 5 minutes, knowing full well that the wall is there if they need it, but now they get a chance to train their erector spinae, their glutes, maybe even stretch out their abdominal muscles. Now it's safe, they can't hurt themselves, and they can practice this at home. Next month, I'll show you some manual therapy techniques to help to reduce the flexion contracture in the knee as well as the flexion contracture in the hip.